You have been ignoring that hip pain. You think it's age, strain, or posture, but what if your bone is quietly dying and without you knowing it? This is avascular necrosis, and it could be silently destroying your hip. Hello, I am Dr. Y.S. Grewal, Senior Orthopedic and Joint Replacement Surgeon at Bombay Bone and Joint Clinic. In this video, I'll help you understand the avascular necrosis of the hip, how we can spot it early, and how we can treat it before it becomes disabling. Avascular necrosis is a condition where blood supply of the head of the femur, that's your thigh bone, gets cut off. Without blood circulation, the bone tissue can die. That can lead to joint pain and joint destruction as well as collapse. AVN can be triggered by long-term and high-dose steroid use, excessive alcohol intake, a previous fracture or dislocation around the hip. Then diseases like sickle cell disease, which can lead to obliteration of small blood vessels. In many cases, it occurs without any reason at all. So you need to watch out for these early signs. Limping, pain in groin or buttock area, stiffness in the hip joint, difficulty in cross-leg sitting or climbing stairs. These could be mild signs, but could be an early sign of avascular necrosis. We diagnose AVN using a detailed physical examination, X-rays to check bone structure, and MRIs to catch early damage, even before the symptom worsen. Treatment usually depends upon the stage of the AVN. In early stage, we focus more on activity modification as well as biological therapies like PRP. In mild to moderate cases, the therapies like core decompression can help restore the joint. And in severe cases, the total hip replacement is the ideal choice to restore mobility and relieve pain. Most people delay seeing a doctor, assuming it's a muscle pull or a strain. But in AVN, the early diagnosis is important. We can save the hip joint if it is diagnosed early, and also we can avoid the surgery. If you or someone you know is experiencing deep hip pain or limping, get evaluated today. At Bombay Bone and Joint Clinic, we offer advanced diagnostic and treatment options for AVN as well as other conditions.